Hello everyone, welcome to the very first video of PYT discussion in this channel. We'll be studying with pediatrics as it's a smaller subject compared to others, and it has topics that are overlapping with the other subjects, mainly medicine. So you can finish it early. So see, pediatrics has some topics which are the co-pediatric topics, and some are topics which are overlapping with others. The co-pediatric topics are these ones: the growth, development, neonatology, nutrition, and some genetics. If you have not done the genetic from pathology. In case of systems, the most of the systems are overlapping with medicine, so you can do it from medicine. Except in case of CBS, FE topics like congenital heart disease, that you have to do from pediatric itself, as it's a very hot topic and questions are repeated every year. The rest, all the systems like RESP, CNS, and everything, you can do it from medicine. It will cover pediatrics also, except probably one or two topics that you will get to know eventually. Again, the infections like infectious diseases or the infections of bacterial, viral, and everything, you can read it up by mixing up micro and SPM. If you have not done it from SPM, then you can do it from pediatrics. But most of the people, what they do, they do it from SPM and micro, and because the questions are asked from the SPM perspectives most of the cases. So, but if you have not done from SPM, then you can do from pediatrics. But make sure you collaborate the subjects with the microbiology portions of bacterial, viral, and parasitology, so that you don't have to study everything separately, and you can do it once and all the subjects are covered. So that's how you should do pediatrics. Today we'll do the growth and development. In the next video, probably we'll do neonatology and nutrition, and in the last one we'll do genetics and a few topics from the systemics. So let's start. First we'll do growth. In growth, the main focus topic is your anthropometry, the parameters of anthropometry. So I've divided the anthropometry parameters into two types. One, the major types, which are height, weight, and head circumference and chest circumference. And other importance are like mid-upper circumference, BMI, and skin fold thickness. So we'll do one by one each of them. First, we'll start with weight. There is nothing much to do from weight. This was in one-liner asked. What's the average birth weight of an Indian newborn? Some books says it's 2.8, some says 2.9. So you can remember it as 2.8 to 2.9 kilogram. This is a very important list or chart. You have to remember. This has been asked. How the birth weight gets multiplied with age. So if the birth weight is X kilogram, then by 5 months it becomes 2x, 1 year it becomes 3x, 2 years it 4x, 3 years it 5x, and so on. By the age of 10 years it becomes 10x. So the last question, they'll give the birth weight and they'll say what is the weight of the child at 1 year of age. So you just have to multiply and answer. So you have to remember this. Then another formula is the formula for expected weight. No question has been asked from this formula, but as they are asking from this chart, so they might ask this kind of question from in next exam. So it's easy. You have to first find the age bracket. If the child is less than 1 year, if the age of the child is from 2 to 6 years of age, and it is from 7 to 12 years of age, and you have to apply in the respective formula. For example, less than 1 year, it is x plus 9 by 8 in months. X is the age given. So you just have to remember these formulas. Read it a few times, you will remember eventually. Next topic is your growth chart. I have not included growth chart in the slide. The kind of question they ask in the growth chart is they will give you the age and they'll give you the weight or height, and they'll give you the growth chart. You have to put the age for that respective weight for the respective age and see if where the what is the range and where the weight of the child falls. If it is between if it is -2 to -1 and so on, and you have to divide it according to malnutrition or normal or undernutrition. So this kind of question you have to solve. This kind of question you have to solve a few question. You have to put the age and weight. You have to know how to put the age and weight on the chart, on the growth chart, and then you have to find the diagnosis. So I'll put a few questions in the Telegram channel so that you can solve, and then if you solve probably a few questions, 4 or 5 questions, you'll eventually know how to solve this kind of questions. Next, we'll start with height or length. If you're taking more than 2 years of age, then you should call it height. If you're taking less than 2 years of age, then you should call it length. So what are the instruments that are used for measurement of height and length? The instruments that are used for measurement of height and length, if you're considering height, then it is stereometer, and if you're considering length, then it is infantometer. You have to know these images. These were PYQ. So for height more than 2 years, it is infantometer, and for length less than 2 years, for height more than 2 years, it is stereometer, and for length, which is less than 2 years, it's infantometer. Just like weight, there is one more chart in case of height also, where the question is asked, what is the expected height? At birth, average height is 50 centimeter of an Indian newborn. By 3 months, it becomes 60 centimeter. 9 months, it becomes 70. 1 year, 75. 2 year, 90. And by 4 year, it becomes 100. So by 4 year, the birth height gets doubled up. From 52, it becomes 100. So you have to know this also. Because the question asked, I'll show you one example. This is the question that was asked in INICET a few years ago. So the question was, at what age height of a child is half of the adult height? Half of the adult height. So if you don't know this chart, you can solve this question. So adult height is approximately 160 to 180 centimeter on an average. So they ask at what age at what age height of a child is half of the adult height. So let's consider the adult height is, for example, 180 centimeter. So half of 180 is 90 centimeter. So at what age it becomes 90 centimeter? It is 2 years. So the answer is 2 years. So if you don't know this chart, then you won't be able to solve this kind of question. It's very hard. It's not very hard. It's very easy to remember these things, and you can this kind of questions are very easy to solve. So please do read this a few times and remember it. Then these are the one-liner they ask. Maximum growth occurs in the first year of life, even more than the puberty. Also 50% growth occurs in the first year of life. So in the first year, the maximum growth occurs even more than the puberty, and the 50% of growth occurs in the first year itself. Okay. Next we do some disorders of height. Yep. So disorders of height, the most important one they ask is the short stature. So what's the definition of short stature? If the height is less than third percentile, or if the height is less than -2 standard deviation or z-score. So if it is percentile, then third, and if it is z-score or standard deviation, then it is -2. Now types of short stature, there are two types. One is the proportionate, one is the disproportionate. What is the meaning of proportionate? In the proportionate, the upper segment and lower segment ratio is normal, and in case of disproportionate, the upper segment and lower segment ratio is not normal. Now what do you mean by upper segment and lower segment? What's the normal value? We'll do it here. So what is the meaning of upper segment? Upper segment means above the pelvis, and lower segment means below the pelvis. That's it. So there's some normal values of upper segment upper segment is to lower segment ratio. For example, at birth it is 1.7 is to 1.7 to 1.9 is to 1. This is upper segment, this is lower segment. At the age of 3 years, it becomes 1.3 is to 1. By the age of 7 to 10 years, it becomes 1 is to 1. So this is a potential question. At what age the upper segment and lower segment ratio becomes 1:1. It is 7 to 10 years of age. Okay. So now the proportionate upper segment lower segment ratio is normal. What are the causes of proportionate short stature? The cause of proportionate short stature is intrauterine like IUGR and torch infection, variation of normal development or normal growth. What is the variation of normal growth? There are two things. One is familial, another one is constitutional delay in growth and puberty, also called as CDGP. What happens in this? What are the difference between these familial and CDGP? The difference are, see, in familial, the child will look short, but when you put the height of the child in the growth chart, you'll get to know his height falls in the normal range. So will appear short, but target height is normal. Also, the parents are short, and important thing to remember is that bone age will be equal to the chronological age. This is the main differentiating point. Also, the onset of puberty will be normal. At normal time, the puberty onset will be there. But what happens in constitutional delay in growth and puberty? Here what happens, the height is less than the expected during the childhood. It is less. So during childhood, when you put the height of the child in the growth chart, you will get to know his height is less. But eventually, if you take when he becomes adult and you take the adult height becomes normal. So after childhood, during puberty or probably post puberty, the height whatever he was not gaining, he gains it and covers it up, and adult height becomes normal. So during childhood he was short, but in adulthood becomes normal. Here what happens, the main differentiating point with the familial is that the bone age is less than the chronological age. Also, onset of puberty is delayed. The name itself says constitutional delay in growth and in puberty. So puberty onset also gets delayed. Okay. Now some postnatal causes or acquired causes. The postnatal causes are nutritional like malnutrition, celiac disease, and IBD, inflammatory bowel disease. Genetic causes like Turner syndrome, Prader-Willi syndrome, Down syndrome. Then endocrine causes like hypothyroidism, growth hormone deficiency, diabetes mellitus, and diabetes insipidus like uncontrolled ones, ricket. The renal causes like CKD, renal tubular acidosis, nephrotic syndrome. Medications like glucocorticoids and some anti-epileptic drugs like valproate. Then psychological conditions like maternal deprivation. These are the causes for proportional short stature. Next is disproportional. So disproportional short stature is what? Where the upper segment lower segment ratio is not normal. This can be of two types. One is short trunk, another one is short limb. What happens in short trunk? The trunk is short, the upper segment will be short, lower segment will be normal. So the height, this ratio decreases, and in case of short limb, the ratio increases. So first we'll do the short trunk. What are the causes of the short trunk? The cause of the short trunks, one is there are four causes. I have a mnemonic, I'll tell it later. This first is Alagille syndrome. Alagille syndrome comprises of a triad. The triad has triangular facies, butterfly vertebra, and pulmonary stenosis. The image I have included here is, this is the triangular facies. The child's face looks like a triangle, and this butterfly vertebra. I'll show you how. See, this is one wing of butterfly, this is another wing of butterfly. This looks like a butterfly. That's why they are called butterfly vertebra. So this is the triad of Alagille syndrome. Next cause is spot spine or Carey spine, that is the TB of your spine. Then spondyloepiphyseal dysplasia and mucopolysaccharidosis. These are the causes of short trunk. The mnemonic I have added is known as SPAM. S for spondyloepiphyseal dysplasia, P for POTS, F for Alagille syndrome, M for mucopolysaccharidosis. You can remember it as SPAM. Next, short limb. In short limb, the ratio increases. Cause of ricket. Achondroplasia is an important cause. It's an autosomal dominant condition. The radiological features in achondroplasia, you will get to know two things. One is champagne glass pelvis, another one is a trident hand. So what happens, the pelvis, inlet of the pelvis becomes very smaller. So it appears something like this, like a champagne glass. That's why this is called champagne glass pelvis, and hand, it looks like a trident. So this is achondroplasia. Then osteogenesis imperfecta is also an important cause, where the bones become very fragile. It is also an autosomal dominant condition, everyone know. everyone knows. Then this guy, his name is Parsh Shah. He's a very inspiring story. He also suffers from osteogenesis imperfecta, and uh, you can look him up on Google. He raps. He's a rapper. And lastly, it is the hypothyroidism. So that's all about your proportional and disproportional short stature, the definition and their causes, the most important ones. Let's go to the next thing, which is the head circumference and the chest circumference. So at birth, the head circumference is 35 centimeter. Normal, right? Again, you have to remember. Very easy to remember. Birth to 3 months, it is 2 centimeter per month. 3 months to 6 months, 1 centimeter. 6 months to 1 year, 0.5 centimeter. 1 year to 3 year, 0.2 centimeter. So you just have to half it up. 2, 1, 0.5, 0.2. Birth to 3, 3 to 6, 6 to 1, 1 to 3 years. It's easy to remember. So at birth, the head circumference is more than the chest circumference. By the age of 9 months to 1 year, it becomes equal. For the sake of remembrance, you can say by the age of 1 year, head circumference becomes equal to the chest circumference. Above 1 year, chest circumference has to be more than head circumference. If it is not, then the child is suffering from malnutrition. Okay. Then another thing is microcephaly, which is when the head circumference falls below -3 standard deviation. Remember one thing, everywhere when you'll read up some definition, like we read in case of short stature, the height was less than -2 standard deviation. This is the only case in pediatrics you'll get to know, only definition where -3 is considered. So head circumference less than -3 standard deviation is the definition of microcephaly. One important cause of microcephaly is Rett syndrome. We had question from this. It's an X-linked dominant condition. The gene associated with it is known as MACP2 gene. And what happens in Rett syndrome is that the head circumference is normal at birth, but after a few months, it starts decreasing. So at birth, if they give a clinical scenario, we're saying the child has a head circumference of normal at birth, 35 centimeter, and after a few months, probably 3 or 4 months later, head circumference is not increasing at per the velocity, at per the rate it should increase, then you should consider it as a Rett syndrome. Also, they will give you MACP2. This was a PYQ also, the gene. Also, the associated features of Rett syndrome is there will be loss of purposeful hand movement, stereotypic hand movement, and there is cognitive and motor difficulties are there. You can look up a video on YouTube about the symptoms of Rett syndrome. You'll see that there's what do you mean by stereotypic hand movement. So that was all about head circumference and chest circumference. Other important anthropometric parameters are mid-upper arm circumference. This is measured using something called Shackle's tape. You have to know the ranges and the color codes. Green, there is no acute malnutrition. Yellow, there is moderate, and red, there is severe acute malnutrition. Actually, you cannot call severe acute malnutrition. Severe acute malnutrition definition has two other things. We'll know it in this one. We'll get to read it in nutrition. So just remember, green is the normal, yellow is moderate, red is the severe. And the range is 12.5 to yellow is your red is less than 11.5 centimeter. Yellow is 11.5 to 12.5 centimeter, and green is more than 12.5 centimeter, which is normal. Next is skin fold thickness. You just need to remember this image. It can be an IBQ. The name of the caliper is something called Herpendon's skin caliper. This is how it looks. Then BMI. The definition of BMI has been asked several times. It is weight by height, kg per meter square. BMI is normally used for child more than 5 years of age. If it is less than 5 years, then we use something called weight for height to know the malnutrition. But if it is more than 5, we use BMI. Now this also asks the ranges of BMI. Less than 5th percentile, it is undernourished. 5th to 85th is the normal. 85th to 95th is overweight, and more than 95th is obese. These two questions has been asked. So 85th to 95th is overweight, and more than 95th is called obese. So that was all about your anthropometric parameters. Now growth pattern graph, this is very important, several times asked these graphs. Several times this graph has been asked, so you need to remember these graphs by heart. Like when you see the image, you should know this is of that what they're talking about. So first we'll talk about gonads. What happens in gonads? Till the age of 10 years there is onset of puberty, it's steady. After 10 years it gives a spike. So this is gonads. What happens in height? 1 year, till 1 year there's a spike, then it becomes steady. Till 10 years there is still puberty, and after 10 years again gives spike. So this is height. What happens in brain? In brain most of the growth occurs by the age of 2 years. So till 2 years you'll see the peak, after that it becomes steady again. In case of lymphoid tissue, the peak is between 4 years and 8 years. Between 4 years and 8 years. So it's steady, then it grows, gives a peak. It's like a bell-shaped curve between the 4 year and 8 year age, and after 8 years it again falls. So these images you need to remember by heart. Next is dentition. So we know dentition, there are two types of dentition are there. One is primary dentition, another one is your secondary dentition. Primary dentition starts at also you need to remember this formula of both. One is 2102, another one is 2123. It is like incisor, canine, premolar and molar. Same incisor, canine, premolar and molar. 2 incisor, 1 canine, 2 premolar, 3 molar. So 2102 and 2123. This is the formula of primary and secondary. So primary dentition starts at the age of 6 months, secondary 6 years, ends by the age of 3 years, secondary by 12 years. If the third molar, which is also known as wisdom teeth, does not erupt. If it erupts, then it is 18 to 25 years. It might not erupt. So depending on, you can say it's 12 year or it is 18 to 25 year ending of secondary dentition. The first teeth, this was the MCQ, the first teeth that PYQ, this first teeth that appears in primary dentition is lower central incisor, and in case of your secondary dentition it is molar 1, last is molar 2, and secondary last is molar 3, that is the wisdom teeth. Total teeth in primary is 20, and in case of secondary it is 28 to 32. Now mixed dentition is between 6 years and 12 years, where you have both the overlapping of both primary and secondary dentition. So it is between 6 years to 12 years. Now there is one mnemonic, nice mnemonic is there to remember the sequence of eruption of your secondary teeth is called as mummy. The mnemonic is mummy is in pain, papa can make medicine. It's very easy to remember. Mummy for M, M1 means molar 1. Then incisor 1, incisor 2, then premolar 1, premolar 2, then canine, then molar 2 and molar 3. The time of eruption is also very easy to remember: 6 years, 7 year, 8 year, 9 year, 10 year, 11 year, 12 to 14 and 18 to 25. It's very easy to remember. If you read 2 to 3 times you can remember. Now one more, we're talking about dentition, one more important topic that has been asked several times is your Hutchinson teeth, which is seen in congenital syphilis. So congenital syphilis has a triad. It is Hutchinson teeth, interstitial keratitis and sensorineural hearing loss. These are the teeth. It looks like there is grouping of the teeth. It can be an image based question. Next we'll go to development. In development, the most important thing is and has been asked several times are the milestones. They'll give a scenario which milestone should be there, which milestone should be there. So you have to read it several times. It's very hard. I'm not saying it's easy, it's very hard. If you have to read it several times, revise it several times to remember it. It's not possible to remember this by reading one or twice. It's not possible at all. So this is how I remember, I read during my preparation. I have written it as it is. If you need 1 to mnemonicals also I have added. I have made it nicely with age sequence. You have to, there is nothing to explain in this thing. You have to do ratta and remember it by heart, and you have to solve questions also. Then only you will know how they are asking question. I'll put the questions on MCQ on Telegram channel. So yeah, you read it up, you remember it, revise it every 2-3 times in a month till the exam. That's how you're going to remember this list. And yeah, there's nothing to explain. If you don't remember anything, let me know in the comments or in the Telegram channel. I'll make a separate video for this. Next is puberty. The definition of puberty, it is according to WHO, definition of adolescence, not puberty, sorry. According to WHO, it is between 10 to 19 years of age. Children are called adolescent. 10 to 19 years is known as adolescent age according to WHO. The first signs of puberty, MCQs, PYQs. For male, it is the testicular size enlargement. Testicular size enlargement. For female, it is breast enlargement, which is also known as thalaki. How will you measure the testicular size enlargement? We have an instrument, something called orchidometer. This is the image of the orchidometer. And for female, we use something called Tanner staging to measure the breast enlargement. So this was a PYQ. Now the disorders of puberty, not many asked. I think only precocious puberty was a question. So the definition of precocious puberty: for male, if the puberty occurs before 9 years of age, and for female, if it occurs before 8 years of age, that's known as precocious puberty. It's called precocious puberty. Now the causes, two kind of causes are there. One is central causes, another is peripheral causes. Central causes, gonadotropin dependent it will be, and peripheral causes, it will be independent of gonadotropin. Central cause in female, it is idiopathic. For male, it is hypothalamic hematoma. Gelastic seizure. There are many other causes, but I have taken one from each. Hypothalamic hematoma, which causes gelastic seizure. Gelastic seizure is an important cause. Now, McQueen-Albright syndrome has peripheral precocious puberty. That's why I have added it here. It has Cafe-Orlai spots, fibrous dysplasia of bones, and peripheral precocious puberty. It's a kind of a triad. Is known as McQueen-Albright syndrome. The next question that has been asked is your IQ, intelligent quotient. It is mental age by chronological age into 100. This is the definition was asked. Then this ranges or the criteria is different. They will give you any what is the definition of mild, what is the definition of moderate. So if IQ is more than 70, it is normal. Less than 20 is profound. Very easy to remember. I have made it easy. If it is more than 70, 70 to 50, 50 to 35, 35 to 20, and less than 20. More than 70 normal, 70 to 50 is mild, 50 to 35 is moderate, 35 to 20 is severe, less than 20 is profound. People often forget profound, so do remember profound. They can ask. The option might not be like this. They might give it like something like this, 50 to 34.9 or something like this, 0.1. So I just rounded them up and made it simpler to remember. So that's all from growth and development. I think I've covered most important or probably most of the PYTs that has been asked. If I missed anything up, you can let me know in the Google form or in the Telegram channel or in the comment section. I'll try to cover it up on the next video. And yeah, this video has become a little bit longer. I'll try to keep other ones a little shorter. So yes, thank you for watching. Do subscribe, like, share this video, follow me on Telegram, write any kind of queries or anything you want, any topic you want to suggest me to make videos on the Google form. The links will be in the description. And yeah, we'll see you in the next video. Thank you for watching again.